Wrist fractures are common injuries that can involve any of the bones in the wrist, including the radius, ulna, and carpal bones. Distal radius fracture, or Colles fracture, specifically refers to a fracture where the broken end of the radius tilts upward. This is the most common type of wrist fracture, often resulting from a fall onto an outstretched hand. It can be associated with displacement of the bone fragments and may involve the articular surface of the wrist joint. Smith's fracture, or reverse Colles fracture, typically occurs due to a fall onto a flexed wrist or a direct blow to the back of the wrist. The distal fragment of the radius is displaced towards the palm, opposite to the deformity seen in a Colles fracture. Barton's fracture involves a fracture of the dorsal or volar rim of the distal radius, often accompanied by dislocation of the carpal bones. It is caused by a high impact force, such as a fall or a motor vehicle accident. Chauffeur's fracture, or radial styloid fracture, is typically caused by a direct blow or a fall onto an outstretched hand with the wrist in radial deviation. It is named chauffeur's fracture because it was historically associated with the recoil of a hand-cranked car engine. The injury may involve the articular surface of the radiocarpal joint. The scaphoid is the most commonly fractured carpal bone, often resulting from a fall onto an outstretched hand. The scaphoid fracture may not be immediately apparent on X-rays, and it has a high risk of a vascular necrosis or bone death due to the scaphoid's unique blood supply. Symptoms include pain and tenderness in the anatomical snuff box, which is a depression on the back of the hand at the base of the thumb. The lunate bone plays a crucial role in wrist motion and articulates with several other carpal bones. Lunate fractures are less common than scaphoid fractures. Triquetrum fracture is the second most common carpal bone fracture, often caused by a fall onto an outstretched hand or a direct blow to the wrist. The fracture may be associated with ligamentous injuries. Symptoms include pain and tenderness on the ulnar side of the wrist. Hamate fractures often occur in athletes who use a racket, bat, or club due to the repetitive impact on the hypothenar eminence. The hook of the hamate is the most commonly fractured part. Symptoms include pain, swelling, and weakness in grip strength. Capitate fractures are rare and usually result from high-energy trauma, such as a fall. The capitate has a tenuous blood supply, making it susceptible to a vascular necrosis. Symptoms include wrist pain, swelling, and limited mobility. Pisiform fractures are uncommon. The pisiform is a sesamoid bone embedded in the flexor carpi ulnaris tendon. Galeazzi fracture dislocation is caused by a fall onto an outstretched hand or a direct blow to the forearm. The fracture involves the radius, and the dislocation affects the distal radioulnar joint, leading to instability of the wrist. Symptoms include pain, swelling, and deformity of the forearm and wrist. Die punch fracture is caused by an axial load on the wrist, often resulting from a fall or a direct blow. The lunate fossa, which articulates with the lunate bone, is depressed, leading to joint incongruity and potential long-term complications such as arthritis. Symptoms include wrist pain, swelling, and limited range of motion. Ulnar styloid fracture often occurs in conjunction with a distal radius fracture. It can result from a fall onto an outstretched hand or a direct blow to the wrist. The ulnar styloid is an attachment site for the triangular fibrocartilage complex, and fractures may be associated with triangular fibrocartilage complex injuries. Symptoms include pain and tenderness on the ulnar side of the wrist. Bennett's fracture involves a fracture at the base of the thumb metacarpal, with dislocation of the carpometacarpal joint. It is caused by an axial force on the partially flexed thumb, such as during a punch. Symptoms include pain, swelling, and instability of the thumb. Rolando's fracture is a more severe form of Bennett's fracture, involving multiple fracture fragments at the base of the thumb metacarpal. It is caused by high-energy trauma such as a crush injury. Symptoms include severe pain, swelling, and deformity of the thumb. Boxer's fracture typically occurs when a person punches a hard object with a closed fist. The force causes the neck of the fifth metacarpal to fracture, often resulting in angulation of the bone. Symptoms include pain, swelling, and deformity of the little finger. Green stick fracture is common in children whose bones are more flexible than those of adults. It typically occurs in the radius or ulna and is caused by a fall or direct blow. Symptoms include pain, swelling, and deformity of the wrist or forearm. Salter-Harris fractures are classified into 5 types based on the involvement of the growth plate, metaphysis, and epiphysis. They are caused by trauma, such as a fall or sports injury. Symptoms include pain, swelling, and tenderness over the growth plate. Proper treatment is essential to prevent growth disturbances.